What causes gum disease? You may have stopped to think about that and say, wonder why people's gums bleed and why people have bad breath and other issues around their gums. Well, the cause is basically something called bacterial plaque and maybe a diet that is too heavy in the breads, pastas, or carbohydrates and sugars that would tend to feed the bacteria in the plaque. And it also relates to our immune system. As you would realize, if you had an illness like an immune compromising illness, your gums would break down more easily. But primarily, the cause of gum disease is the type of bacteria in your mouth and what they're being allowed to do, either because of neglect or because of the gradual progression over time of those bacteria down into the sulcus or the trench around the tooth. So there's like a trench right around each tooth. And it's like a turtleneck, and that is where the bacteria play. And in there, if they get deeper and deeper, we start to measure what we call gum pockets. And gum pockets can go from 2 millimeters to 3 millimeters to 4 millimeters, and all of a sudden we're into a 5 millimeter or 6 millimeter gum pocket, maybe back around back molars. And I've measured thousands of mouths, and I know that the back teeth are the hardest to clean, and they always have the deepest pockets. And where does it happen? Always between the teeth. I'd say 80% of the gum disease is between the teeth. So we want you to be flossing, and we'll also clean your teeth, and if we have to, we'll stop and reverse gum disease with the new 1064 nanometer laser by the Millennium Company in California. And that is really the key, is that we have to stop the bacteria that are causing the disease. So if you want more information, email us info@dolphindentistry.com or phone us 613 to learn more. Call 234 and 5758, make a smile date.